Okay, so BBC and lots of other news outlets have been mocking RFK as a conspiracy theorist for saying that antidepressants can be harder for some people to get off than heroin. Well, what we're going to be doing today is reacting to a pharmacist talking about her experience coming off antidepressants. Let's check it out. And for those of you who don't know me, I'm Dr. Josef Witt-Doerring. I'm a psychiatrist and I help people safely come off psychiatric meds.
Hi, let's talk antidepressant withdrawal. I'm a pharmacist and I have experience with antidepressant withdrawal. I was put on Prozac in my early 20s after being started on birth control. I was on birth control for about 6 months and I started experiencing debilitating anxiety. I went to my OB and she put me on Prozac.
That's something that a lot of people miss about the oral contraceptive pill. This is a hormonal medication. Our hormones are intricately involved in our mood. And a lot of women who take these medications notice that their depression worsens or their anxiety worsens, or in some bad cases, they even become suicidal. This is widely known. Many people who are kind of up to date on drug side effects know that the oral contraceptive pill can be a gateway drug essentially into taking psychiatric medication unnecessarily.
I wish that she had just said, oh, maybe birth control is not a great option for you. But here we are. It's now 25 years later, and I am still trying to come off of antidepressants.
Isn't that crazy? You get on it for birth control, and then you're stuck on it for 25 years.
I tapered once at the 3-year mark. I followed my doctor's instructions to take half of my dose for a few weeks, and then half of that for a few weeks, and then stop.
See, this is what I've been telling people. Well, sometimes people argue with me and they go, Dr. Josef, people get tapered slower. Everyone's doing a slow taper. This is actually what doctors are telling people to do because they've been told for decades by the marketing groups, within the pharmaceutical companies who are masquerading as being kind of non-biased, that the withdrawal is mild and self-limited, meaning that it goes away in 2 to 3 months. And so the doctors, they taper people quickly, and it doesn't work, just like she describes.
By 3 months, I was debilitated with anxiety and depression.
Does that sound like mild and self-limited to be debilitated 3 months after coming off a medication? No, that sounds potentially worse than coming off opiates, because most people, when they come off opiates, are better within, I would say they're pretty bad for the first 2 to 3 weeks, and then usually by about the 2-month period, most of it's gone away.
I thought that was my baseline, and I resigned myself to being on an antidepressant the rest of my life. What I know now is that that's absolutely not true. That is completely withdrawal, and that it's very common in the 3 to 4 month mark to hit the hardest part of withdrawal.
Yeah, so this is the real sad thing about the misinformation about how easy it is to come off antidepressants. And obviously there's an agenda there. They don't want doctors to be worried about this. They don't want patients to be worried about getting on them. But yeah, if you've taken them for several decades and then you try and come off quickly, you're going to go into severe withdrawal. Your brain has been adapting to that drug, essentially disrupting your physiology for several years. Now, people sometimes think that these antidepressants are these magic bullets and they just act on your mood, but they don't do that. When you disrupt your serotonin system or your dopamine system, you're disrupting the way your heart beats, you disrupt the way your gut functions, you also alter your immune system, and your body doesn't like this. And so it sends signals back up to the brain, and it causes changes up there to fight against the drug. That's why people develop tolerance. They never talk about tolerance to these meds, but that's the process, and that's why. And so when you pull these drugs out after decades of use, within the space of like a month, you get plunged into withdrawal because you've like pulled scaffolding out of your brain, and you haven't given your brain enough chance to readapt. And then you end up like this woman now who goes into severe withdrawal. And then the doctor says, well, I was taught that this was mild and self-limiting. And so they say, well, it's your underlying condition. You just have to get back on the drug. And then you're trapped on a medication you don't want to be on in the first place.
I wish I had just pushed through. Instead, I went back to my psychiatrist and I got on a different antidepressant thinking it would help. Through the years, I had to add on other medications. For example, I got put back on Lexapro, and it absolutely destroyed any sex drive that I had. So then they tried Wellbutrin to try and help with that. Problem with all of that is that I concluded that my baseline was horrible anxiety and depression, and that I needed these medications just to get by. And that's not true. I think we really need to educate ourselves and providers that withdrawal is real and that it lasts a long time.
I mean, this is the scandal out there. Putting someone on a drug, and then at the beginning they go, is it going to be hard to come off? And you say, well, no, the withdrawal is usually mild and self-limiting. And they say, well, how long does it go for? You go, 2 to 3 weeks, it's fine. And then essentially you've gotten someone's brain, addicted to these drugs, and then they can't come off. I mean, what a way to gain a patient for life.
And that the more you go on and come off of medications, and especially if you cold turkey it and have a hard time with withdrawal, that subsequent times when you try to come off, it's going to be harder. So it's important to taper properly. And that's not over a month or even a few months. I think if you've been on them long term, more than 5 years, you need to take 6 months or so to come off.
Sometimes even longer. I've seen this go up to 18 months sometimes.
What I experienced coming off of SSRIs was just a huge list of awful symptoms that I had never had with anxiety before in my life. Absolutely panic attacks, pain, body pain. My hands hurt like crazy, my hips hurt like crazy, my legs. I had tingling in my feet and hands. All kinds of weird feelings that it's hard to even explain. The brain zaps are part of it, but just a whole change in your perception of the world. It feels like there's danger everywhere and that nothing is going to be okay ever, and it's the biggest lie.
So what she's describing may actually be a condition called protracted withdrawal, because what happens to some people when they go into these severe withdrawal states, usually once they've been white-knuckling it for the first couple of months, they become neurotoxic. There's something about being in that withdrawal state that actually hurts their brain. And so they will describe a few things. The most common thing is severe anxiety that is catastrophic and obsessive. They'll also have cognitive dysfunction. They experience something called paresthesias, which is like numbness and tingling in your hands and feet. They get gastrointestinal problems. It really feels like torture. Now, the problem with this is that sometimes it doesn't go away when you get back on the drug because this withdrawal can sometimes be damaging to the brain. So sometimes people jump back on the antidepressant and they still feel terrible for years afterwards. Essentially, they're just waiting for their brain to heal. And they're just thinking, what's going on with me? And then they often get put on multiple different medications.
So my goal as a pharmacist now is to educate as many people as possible that tapering is essential. If you want to come off your SSRIs or benzos or anything like that, you need to do it very slowly.
This is for 2 reasons. One, it's to avoid severe withdrawal, which can put you at risk of a condition called protracted antidepressant withdrawal. If you've never heard of it, go to survivingantidepressants.com. It's horrid. And 2, just to get off them safely, because if you don't, you can completely destabilize your life and you're just not going to be successful.
And that it's going to be very uncomfortable and it's going to test your limits, and you need your people to help you out.
That's not true for everyone. It can be really uncomfortable if you've been injured because you've come off too quickly in the first place. But if you do it right the first time and you just come down very gradually, you don't expose yourself to severe withdrawal. You just have to be patient and give it time. I have a link up here to another video that we did recently. It's called The Beginner's Guide to Psychiatric Med Withdrawal. It's on YouTube. You can check it out and it shows you exactly how to come off safely.
It's not something you should do in secret. You're going to need someone to look out for you and to be there for you. But I promise you, if you do it slowly and you keep trying, that there is light on the other side and it gets better. And you can live without these medications. For a long time, I thought, I will never be without these because I thought that withdrawal was my baseline, but it's not. It's not. You can do it.
Wow. Look at her face. That is the face of a woman who has seen some shit. Now, some people are trying to say that those, doctors like me and other patients out there, we're Scientologists, we're plants, we're people who just, hate psychiatric medications because we believe everyone should just toughen up and we're really insensitive. Did you get that feeling from that lady? Did you think she was a plant? Or did you think that was a genuine person who tried to come off antidepressants and she's been stuck on them for 25 years and it has literally been harder than coming off heroin? I want people to make up their own mind about this, because the media is trying to tell people right now that this cannot happen. It absolutely can. If you want to learn more about this, I've done a deep dive into the literature on severe antidepressant withdrawal. Check out this video over here.